Some said you referred to the self-promotion and the screening. So when we found, said in the few reports or the work that we've done over the years, is that the Muslim communities, they're less likely to access the screening program. So we know that there's a national breast screening program that starts from the age of 15 above for women, but Muslim women are less likely to uptake these screening programs. So a similar thing for the cervical cancer screening program, the bowel cancer screening program that starts at age 55 as well for men, and newly running as well is now the lung cancer screening program, where people are invited for the CT chest scans, but that's been only started running. In terms of when you said there are several barriers, what when you say that are some of the barriers?
So as you know, we are we recently had Cervical Cancer Awareness Week, or was it day? I can't remember. And there have been some studies that have looked at what the barriers are that women experience when it comes to cervical cancer screening. And I'm going to have to look up the statistics. And I was actually making notes, so I should be quoting some statistics. So we have them ready. So and then just quote a couple of studies. And some of the barriers are that firstly, they may not be aware of what cervical cancer is and what the importance of screening is. There's also this idea that if you are not sexually active, that you don't need to have cervical cancer screening. Plus, women have experienced that negative attitudes from healthcare professionals. They don't feel comfortable going in, or if they are seeing a male healthcare professional, obviously in cervical screening, that isn't so much of an issue because the majority of screening that takes place is in primary care, and that's done by practice nurses who generally tend to be women. But there is some interesting developments that's taking place around cervical cancer screening in general, and that's the idea that that women can just do self swabs rather than having to go into a GP surgery and have a swab done with a speculum, the plastic tube that goes inside, and now they can do a simple self swab, and that's a program that's carried out in a few countries around the world, and it's being piloted in an area in the UK as well. It'd be really interesting to see what the results of those showed, because I think that will really improve the uptake, especially in our communities, for cervical cancer screening.